everyone, welcome to my YouTube channel. I am going to upload the whole syllabus of anatomy including upper limb, lower limb, thorax, abdomen, pelvis as well as CNS. I have already completed with the lower limb session. I have started with abdomen and pelvis part. Our today's topic is stomach. Let's begin with the definition. Stomach is a muscular bag forming the widest part of digestive tube. It acts as a reservoir of food and helps in digestion of carbohydrate and protein. So as we all know, stomach is a muscular bag which stores the food and it is a part of digestive system. Location: it is located in the upper left part of the abdomen. It occupies epigastric region, umbilicus region and left hypochondriac region. Shape: it in the normal active person it is J shaped, as you can see in the diagram it is J shaped. Size and capacity: about 25 cm long, 30 ml at birth, capacity is 30 ml at birth in children, 1 liter at puberty and 2 liter or more in adult. External features: it has two orifices, cardiac orifice and pyloric orifice. Cardiac orifice: it is joined by the lower end of the esophagus, abdominal esophagus, present between the left 7th costal cartilage, present behind the 7th costal cartilage, 2.5 cm away from the sternum and at the level of T11. Pyloric orifice, which opens into the duodenum at the level of L1. Its position is indicated on the surface of the stomach by two things. First is by prepyloric vein and second is by circular groove. It has two curvatures, lesser curvature and greater curvature. This is lesser curvature and this is greater curvature. So lesser curvature is concave, forms the right border of the stomach and provides the attachment to the lesser omentum. Greater curvature is convex, forms the left border of the stomach and gives the attachment to the greater omentum, gastrosplenic ligament as well as gastrophrenic ligament. It has two surfaces, anterior surface which face forward, upward and posterior surface which face backward and downwards. It is divided into two parts by angular incisura. It is an imaginary line called as angularis incisura, because of which the stomach is divided into two parts, cardiac part and the pyloric part. This is the cardiac part which includes the fundus and the body, and the pyloric part which includes pyloric antrum and pyloric canal. So cardiac part is further divided into fundus and body. Fundus: it is a upper convex dome shaped structure situated above the horizontal line drawn at the level of cardiac orifice. This is the cardiac orifice situated above the horizontal line. This is the horizontal line, above the horizontal line drawn from the cardiac orifice. Body: it is between the fundus and the pyloric antrum. This is body between the fundus and the pyloric antrum. Pyloric part, which is divided into pyloric antrum and pyloric canal. This is pyloric antrum and this is pyloric canal. So pyloric antrum is 7.5 cm long and pyloric canal is 2.5 cm long. This is pyloric sphincter and this is pyloric constrictor. This is pyloric orifices. Relations of the stomach: peritoneal relations: it is lined by the peritoneum on both its surfaces. At lesser curvature, layer of peritoneum anterior and posterior meets become continuous with the lesser omentum. At lesser curvature, the layer of peritoneum anterior and posterior layer meets and become continuous with the lesser omentum. At greater curvature, both the layer anterior and posterior layer of peritoneum meets and become continuous with the greater omentum. Near the fundus, two layers meet to form the gastrosplenic ligament, and near the cardiac end, two layers meets to form the gastrophrenic ligament. Visceral relations: anterior surface is related to diaphragm, transverse colon, left pleura, pericardium and 6 to 9 ribs. Posterior surface, also called as stomach bag, is situated. It is related to diaphragm, left kidney, left suprarenal gland, pancreas, transverse mesocolon, splenic flexure of colon and splenic artery. Blood supply: lesser curvature is supplied by the left gastric artery. As you can see in the diagram, this is celiac trunk, and from celiac trunk gives branch to left gastric artery and splenic artery and common hepatic artery. So lesser curvature is supplied by left gastric artery, which is a branch of celiac trunk. Right gastric artery, which is a branch of proper hepatic artery. This is the right gastric artery, which is a branch of proper hepatic artery. Proper hepatic artery is a branch of common hepatic artery, which is a branch of celiac trunk. So as you can see, this is celiac trunk, which gives three branches: left gastric artery, common hepatic artery, and splenic artery. So left gastric artery is a direct branch of celiac trunk, and common and right gastric artery, it is a branch of proper hepatic artery, which is a branch of common hepatic artery. Greater curvature is supplied by right gastroepiploic artery, which is a branch of gastroduodenal artery. Right gastroepiploic artery, which is a branch of gastroduodenal artery, and left gastroepiploic artery, which is a branch of splenic artery. Fundus is supplied by 5 to 7 short gastric arteries, which are a branch of splenic arteries. Right and left gastric vein drain into the portal vein. Right gastroepiploic vein drain into the superior mesenteric vein. Left gastroepiploic vein and short gastric vein drain into splenic vein. So this was the venous supply. The lymphatic drainage of the stomach, which includes 4 parts: upper part, right 2/3, a lower part of left 1/3, and pyloric node. A, B, C, D, as you can see in the diagram. So upper part of left 1/3, this part drains into the pancreatico-splenic nodes, which lie along the splenic artery. This was the splenic artery, so it lie along the splenic artery, called as pancreatico-splenic nodes, which reaches the celiac trunk, which drains into the celiac trunk. Right 2/3, which drains into the left gastric nodes to reach the celiac trunk. Lower left 1/3, which drains into the right gastroepiploic nodes, which lie along the right gastroepiploic artery. This was the right gastroepiploic artery. So the right gastroepiploic nodes lie along the right gastroepiploic artery, which drains into the subpyloric nodes, then hepatic nodes, and then celiac nodes. Pyloric node, which drains different direction into the hepatic, pyloric, gastric to reach the celiac node. So upper part of left 1/3 drain into the pancreatico-splenic nodes, which directly drain into the celiac nodes. Right 2/3, which drains into the left gastric nodes, which drains into the celiac nodes. All the lymph nodes drain into the celiac nodes only. Then lower left 1/3, which drains into right gastroepiploic nodes, then subpyloric nodes, then hepatic nodes, then celiac nodes. And pyloric nodes drain in different directions. It can drain into hepatic also, pyloric also, gastric nodes also to reach the celiac node. Nerve supply. Sympathetic nerves, T6 to T7 spinal segments via the greater splanchnic nerve, celiac nerve, and hepatic plexus. These are motor to the pyloric sphincter but are inhibitory to the rest of the gastric musculature. Parasympathetic nerves, which supply from the vagi via the esophageal plexus and gastric nerve. Anterior gastric nerve contain left vagal fibers and posterior gastric nerve contain right vagal fibers. Clinical anatomy. Peptic ulcer can occur in the sites of pepsin and SCL, namely in the stomach, first part of duodenum, lower end of the esophagus, and mucus diverticulum. It is common in blood group O. Causes are mental stress, smoking, alcohol consumption, Helicobacter pylori infection, H. pylori infection, non-steroidal or anti-inflammatory drugs. Gastric ulcers, which can occur along the lesser curvature of the stomach. These are common in the people who are always in hurry, mostly worry about the incidents and eats spicy curry. This is it means that the person who is always in hurry and eat spicy foods without doing any exercises and always in anxious state, in worry state. This kind of people are more prone to get the gastric ulcers. Gastric carcinoma, which occurs along the greater curvature of the stomach. So this was all about the stomach, which is an important topic as point of view of university exam. It can come for 10 marks as an MBQ. So I hope you understood the topic. If there is any query, you can comment me in the comment section, and if you want such more videos, subscribe to my channel and follow me. Thank you.